You're able to see the screen as well?
Yep, I can see it. Yep.
Beautiful. Okay. Well, if
Yeah.
you're happy then,
Yep.
we can put 5 minutes on the clock and your time starts now. Your reading time is up. The case time begins.
Hi,
Oh,
Michael.
hey, Doc. How you going?
Good. How are you?
Oh, yeah, been better to be honest. It's been a rough couple of months.
I see you brought Emma. Is that your daughter? Yeah.
Yeah, my daughter. Yeah, she's 4 now.
Okay.
She grows up so quick.
Yeah. How can I help you today, Michael?
Yeah, look, I'm just worried. We heard there's been more measles outbreaks in the state. Our school recently had a chickenpox outbreak as well, which
Yep.
this day and age, I thought everyone was immunised, and I guess that's part of the problem. Really, is Emma never got any of her immunisations. Her mother, oh, she always anti-vaxxer, and no matter how much I tried to convince her, just flat out refused. So is there some kind of like catch-up program we can do, or some way to get her topped up and back on the
Oh,
schedule?
yeah. We do have a catch-up program. So, could I just ask you a few questions
Yeah, of course.
before we start off?
Yeah.
So, Emma, has she not had any of her immunizations since she was born, or?
No, since she was born, her mother is into the whole
Yeah.
alternative living thing, which,
Yeah.
you know, back when we were dating, it was fine, but, now we
Yeah.
got kids. It's one of the reasons why we ended up splitting up, truth be told, was just different parenting thoughts and styles.
Yeah.
Yeah.
And have you guys discussed in length about it with with someone else or any doctor or nurse or what regarding this
Uh,
decision?
well, a couple of years back, I think she was
Yeah,
1 or 2, she had fallen over and scraped her knee up pretty bad, and the doctor
yeah,
then was asking about, immunisations and tetanus shot or something, and
yeah.
yeah, my wife just lost her mind. Went on this big rant about how they're dangerous and cause
Okay,
autism and things. So yeah, it never
right,
got followed
right.
up on.
And so Emma has never had any immunization, and she never had any adverse reaction from any immunization that you know
Well, she's never had them, so no,
of?
no
Okay, right,
reactions.
right. And she's not allergic to anything that you know of?
Her mother says she has all these allergies based off some homeopathic test thing they did,
Yeah,
but she's never actually
yeah.
reacted to anything and never had any rashes or anything. So yeah, I don't really
Okay.
know.
How are you? I'm sorry to hear that about your recent divorce, but how are you coping? How's your arrangement with Emma with your ex-wife regarding
Yeah,
the care
yeah.
for
No,
Emma?
yeah, I'm fine. Like it's been years in the making. We kind of saw
Yeah,
it coming for quite some time.
yeah,
Obviously, we've got very different worldviews.
yeah,
Um, we're doing joint custody at the moment, but
yeah.
it's doing my head in. I'm going to try and put in to try and get more custody. I think we're trying to do alternating weeks, and it's just so disruptive
Okay.
for Emma.
And have you all went to the courts or anything, to discuss this matter? Like what sort of, the health and financial matters or anything like that? Have you all had any discussion about that?
No, not really. Is there? What are we
Yeah.
supposed to do for that then?
Okay. Well, uh, s- for Emma to get the immunization,
Mm,
unfortunately, it's a bit complicated that because two parents are not agreeing and not seeing to eye, and we don't have actually paperwork to see who has that sort of right. So naturally, we need both parents to agree.
right.
But also the other thing is there's a lot of uh, child center, daycare center. If your child is not immunized, they might not allow your child to participate.
Yeah, well, that's one of the problems we're having is she was
Yeah,
in one place that was a alternative
yeah,
kind of place. I actually don't even know if it was actually registered, truth be told. And
yeah,
we're trying to find new places for her now because we're living a couple of
yeah,
hours apart.
yeah.
And yep, struggling to get in anywhere. I mean,
Okay.
surely, like everyone says you need to have it done. Can't we just do
Yes.
it?
Yes. Not really. So it's a bit tricky. So what will be the case is you will have to go through a court proceeding, and obviously the court is going to finally decide on the child's best interest,
Right.
and
Does this
that's
happen all the
how
time or?
uh let's just say it's not something that is often happens, but it do happen from time to time. But the law, whenever there is two parents who have different ideas and different expectation, the law will decide on the child's best interest. So it could be the case that the law decides that the Emma can have the needles, and that's it. But you just have to go through court proceeding. Legally, I can't. But one way is I could schedule a meeting to speak to Emma's mom, if she's happy to have a chat with me to discuss about, her worries about the needle, especially with the autism side of things, because we know now that it's all been debunked and it's not true that
Yeah.
autism is caused. And I don't want to discredit Emma's mom. I'm pretty sure she would have did her own research, but sometimes some of the things that we get from the internet might not be from the right source. And I'm happy to point out and, have a discussion and all that.
Oh, that'd be great because she's on all these Facebook groups that all just kind of feed
Yeah.
into each other.
Yeah.
Yeah, no, that'd be amazing. I mean, bring earplugs because she's going to lose her mind, I'm sure. But
we doctors always have, patients who might have different sets of belief and all that, but we are here to help, and we are here to, to set things clear and, to point the patient to the right pathway and stuff. Because as you know, without the immunization, Emma has a risk of getting severe infection like, measles. The immunization is not 100%, foolproof, but it does protect Emma against this vaccine preventative disease.
Okay. Because that's my worry is, there's all these
Yeah.
outbreaks of stuff and she's not protected. So
Yeah, I do agree. I think it's fair if Emma can come, Emma's mom can come along, and if she's happy to sit with you yourself and we can have a discussion. I'm happy we can do that face to face. I can bring some handouts to explain what I'm gonna say, and maybe it might just take some time for Emma's mom to understand what's the benefit from getting the vaccination and all that. There are risks also as well with the vaccination, like some child can get a bit of fever, a bit of pain and all that, but it's not something really serious. The most serious thing is probably anaphylaxis, but I wouldn't say that's something very common. It's it's in some of it is in a million chance actually.
yeah, okay.
Yeah,
Better
but
than getting measles, I guess. So.
yeah, but how's Emma taking with all this divorce, like with both of you all, going your separate ways?
To be honest, we've been fighting for as long as she's been alive, so I think it's just kind of part of the package for her.
Yeah.
She's doing pretty good. She doesn't
Okay.
fully understand everything that's going on, but just knows that back and forth, back and forth.
And is she are you a stay-at-home dad, or who looks after her?
Yeah, I'm pretty lucky. So I'm a truck driver, so I do lots of long hauls. So I'm able to kind of plan out my weeks so that I do a week where I'm pretty much on the go non-stop, and that's when she's with the mother. And then I get a week off and I can just be with her at home all that week. So that's working well. But I'm thinking I might try and pull back hours because I can actually step into a more office kind of role. And I'm not getting any younger, so and that would mean I could potentially keep her with me. Getting her into childcare though is the hard part right now because, as you say, no one will actually accept her.
And did you had any concerns with Emma's development per se?
No, she's a little champion.
No?
She's
Okay.
all going on 40. I swear they grow so quickly.
And how's the interaction? Do you have any other kids, or is this the only daughter?
No, just one. We realized quickly that even for the both of us, one was probably a mistake, and probably wasn't fair for Emma, truth be told. But here we are.
Okay, right. And do you have a partner now, or are you just?
No, I'm having a break.
Okay.
Yeah.
Right.
Well, Emma is more than enough for my life, right?
Oh, okay.
I mean, could I just kind of? I've seen ads for like the immunization clinics.
Yep.
I could just kind of take her there and not mention anything about her mum. They might just do it.
Well, you're right in that sense. They might, if you don't say that. But then that would be something pretty hard actually, because sometimes not every doctor will ask, are you all separated or anything like that. So if that happens, uh, the court will also see in the favor of the child also as well. And I'm assuming that doctor probably have to speak to his medical indemnity also as well to get. But the ideal way is actually with separated parents is both parents need to come agreement for the child's welfare
Yeah,
and
well, I
stuff.
don't want to get a doctor in trouble. That's
Yeah,
okay. That makes
yeah.
sense. And
It can be very mucky, like if Emma's mom decided to take the doctor for legal suit and all that, it can be quite a case and all that. I wouldn't really suggest doing that. And I think the best way is one way is like I was saying, that if we can sit down on and discuss. If we can't get a resolution or some sort of agreement, then I guess moving forward is actually you guys will have to engage a lawyer and go from there, the court proceeding.
all right, doc. I
Yeah.
guess that's just
And
what we'll have to
once
do.
we already
Yeah,
have that, I can talk to the public health and we can come up with a schedule for catch up
yeah.
vaccination and all that.
Oh, that'd be great. I
Um,
mean, would you be happy to just kind of prepare that? So
no,
that when
yes,
she,
yes,
because
yes,
then she
yes.
can kind of have a look at that, I guess, and
Yep,
um,
yep.
we could run
I
through
can
that
show
as
it
part
to
of it.
Emma's mom also as well, what we
Yeah,
will
yeah,
can
yeah. That's what I'm
we
meaning.
can do
Yeah,
and stuff. Usually after the vaccination, I usually give a handout, what are the things you need to watch out.
yeah.
But it's just a simple handout and all that, nothing too complicated and stuff.
Uh,
Um,
I think simple would be good for her, if you know what I mean.
yeah, yeah.
Hmm.
Um, how is the other thing I forgot to mention? I mean, you were saying that she's growing too quick, and you're happy with how she's going. How's the diet like and all that? Good.
A bit of a fussy eater, but
Yeah.
I think it's within the scope of normal, I'd say. So I think all kids go
Yeah.
through a phase where they just want chicken nuggets and
Yeah.
sauce, but yeah, we
Yeah.
try not to give it to her too much, of course.
Okay. I
Mm.
do. Is there anything else that you think I should talk about that I might have not covered or anything?
No, look, I think you've covered all my things. I think we probably need to go back to the lawyers again, have a chat
Yeah.
about that. But yeah, if we can tee up that meeting to kind
Yeah.
of run through everything, if you've got the handouts and a schedule together,
Yeah.
that'd be amazing.
Yeah. And I'm
Maybe we can talk
happy,
sense.
because for a child that is uh, coming out from having a parents who are separated, sometimes they can be affected mentally, and it's kind of hard sometimes.
Hmm.
And I sometimes do like to take history from both parents, like even Emma's mother, if she did
Oh
notice
yeah,
any changes in
yeah,
terms of Emma's mental health and all that. Worthwhile, we get that also
yeah. No,
organized and
I mean,
stuff.
to her credit, my ex, one thing she is big on is
Yeah.
she loves her kids. So
Okay. Excellent. Yeah.
yeah,
Yeah.
I think that'd be
Yeah.
fine. Yep.
I'm sure we can always get something worked out actually. It's just sometimes it might just take a bit of time.
Mm.
You might not need to go to the court. Like I said, the first step is coming to the doctor's consult so that we can talk about this and go from there.
All right. Okay. Well, I'll go see reception, I guess, and make that extra appointment. And
Yep.
yeah, I'll
Yep.
give her a phone call and tell her to come over.
Yep. Yep. No worries.
Mm. You have 25 seconds left to do with as you please. And you will get, on the day as well, you're
Yeah.
going to get probably multiple cases where you feel like you've got this extra chunk of time at the end.
Yep.
That's fine. If you quickly go through your notes again, if there is something else you want to bring up, it's always a great opportunity to just sneak in last minute. But
Yeah,
that's your time there. Thumbs up.
I should ask about what do you think about autism for the vaccination and stuff?
You actually did. You actually did assess my beliefs there, and I said, oh yeah, no. So that was fine. What a case.
Yeah, it is quite tricky actually. This case.
Yeah. And you did fantastic as well, I have to say. This is an intentionally difficult case that's designed to trap you a little bit and to tease out, one, what do you know about the Australian legal framework? And as you very correctly and appropriately identified, this was not a kid that you could immunise. Now, there is going to be variation location to location, so it's all going to depend a little bit on where you're based. But you're correct that for most places, you need both parents' consent in order to do anything to the child, especially if there isn't clear legal frameworks or guardianship orders in place to determine who has the right to make medical decisions for the child. So I really like that you spent that bit of time at the start teasing out kind of, were orders in place? Is this something you guys have discussed? You very quickly identified that, the mother probably wasn't going to be consenting anytime soon. I liked as well that you went through kind of a framework then of ways to get that on board. So bringing the mother in for chats, preparing handouts, preparing resources, absolutely fantastic. The going through the appropriate legal channels as well was a big tick in your favour. And I wasn't sure if you were going to mention, so I did tease out, admittedly, the I'll just go to another clinic and just say the mother consents or just get it done there. I think you did well to kind of point out, hey, you're actually going to get someone in trouble for doing that. Although I am aware that is something that some places may do. And this is also why whenever you're doing vaccinations, really, really important to ask and document appropriate consent has been obtained. And it's tricky. We can only protect ourselves so much. If people are going to lie or do things dishonestly, they're going to. But it's why we write very detailed notes to make sure that if anyone comes knocking on our door saying, hey, you vaccinated this child without consent, that we have something to go back to say, no, we got that consent there. Now, there is the RACGP pre-immunisation kind of checklist that you can run through, and I would always encourage everyone to have a copy of that scanned to files as well. To, one, do best practice, but also cover your own backside. Well done. Very well done. That was, as I said, an intentionally difficult case, and I think you absolutely smashed it, mate. You are prepared and then some.
I hope the CCE will be not too hard this time, actually. I'm just very nervous sitting it for the second time, actually. I don't know what to expect again.
If you do half as good as you just did, you're fine. Yep.
I just want to pass that.
Yep. No. I think you did really, really well there. So well done, mate.
All right. Thanks a lot, Kane. Thank you so much.
Anytime.
Yeah.
All right. So I'll just quickly step through the feedback for this case as well, and I need to switch the screens. So for this case, the competent candidate demonstrates an understanding of the custody and legal arrangements related to parental consent for immunisations, showing knowledge of the Australian legal requirements for consent, particularly in cases of joint custody, and outlining appropriate steps for the patient, including potential mediation and or legal action if needed. The communication, I think, was done really well there, showing that empathy, addressing the father's concerns, but also explaining the complexities around this. And reinforcing that there is actually specific ways this has to be done. Good use of handouts, evidence-based guidelines, acknowledging that the evidence is usually for giving immunisations. In fact, this is a situation that came up a lot during the pandemic because there were rules that came out that said kids had to be vaccinated as well. And of course, there was a lot of conflict around that. The cases that did go to the Supreme Court, it was overall to say that, yes, the children can be vaccinated. And of course, that happened. And final note there is, thank you. Sorry, I thought better give it a try one last time. Yep, you did. You did well. Well done.